Okay, perfect. Welcome everyone to tonight's webinar. We are so excited to have all of you with us. Tonight, we are having a webinar titled The Registry of Unmet Needs, also known as the Innovations Waiver Waitlist, and it's presented by Jenna Flynn, who is an integrated care professional with the Autism Society of North Carolina, and we do anticipating running until 8:30 p.m. tonight. My name is Christy Moore, and I'm going to be hosting tonight. I'm the Family to Family Health Information Center Program Lead with the Exceptional Children's Assistance Center. And that little girl right there is my inspiration for doing the work I do. She's 13 years old and got a diagnosis of autism and a genetic disorder when she was 5 years old. All right, so I'm going to go through a little housekeeping. If I cannot hit that control. So this webinar is being recorded, and a link to the recording will be provided in the follow-up email that's going to be sent out to everyone who registered. That email will go out on Monday. So by Monday, close of business, you will have that. The follow-up email will also include the slides and additional information on the Innovations Waiver and Registry of Unmet Needs. We hope that you guys have lots and lots of questions. And we have lots of people joining us tonight, and that is fantastic. Please put all of your questions that you would like answered by Jenna in the Q&A. So at the bottom, you should see a little icon. There's the chat, and then there's another one that says Q&A. So if you put all of your questions in there, we can make sure that they don't get lost, and we can address those at the end of the presentation after Jenna gets through all of her material. And just due to the large number of attendees, we're not going to be able to unmute participants to allow them to talk. But if you have additional questions or questions that didn't get answered in the Q&A, or just very, very specific questions that are nuanced and pertain to your personal situation, you can email those to Jenna or to me, and we'll provide our email addresses in the follow-up information. When Jen is done presenting, I'm going to launch an evaluation poll. It'll be a poll that just pops up on your screen. I think that some devices, if you're on a phone or a tablet, it may not pop up. I'm hoping that it does. But ECAC is largely funded by grants, and we collect data on all of our activities for grant reporting purposes and to make improvements and to create content that meets the needs of families and professionals. And we would really appreciate it. It's really short. It's like 4 multiple choice questions, and that will launch once Jenna is done presenting. Okay, so quickly before Jenna gets started, I wanted to provide just a little bit of basic information on what the Innovations Waiver is. So the Innovations Waiver is a Medicaid home and community-based services waiver that waives certain Medicaid requirements, such as that income threshold for parents and guardians or the family, and only the income of the person with a disability is considered in eligibility. It provides specialized services and support for people with intellectual or developmental disabilities or related condition, and it allows for people with IDD or related conditions to live in the community instead of an intermediate care facility or an institution. And the Innovations Waiver serves all people ages birth till they die or move out of the state. And there's a couple of other ors too, but we're going to leave it basic with that. I was like, and there's this, but it's a birth to death waiver. And once you have it as long as you remain eligible. So a lot of folks will call and ask, is it worth it to go through all this trouble? The wait list is so long. My kid already has Medicaid. What does this do? So this is a list of services, specialized services that the Innovations Waiver provides. This is a lot, and you read some of these and you're like, well, what exactly is that? What does that mean? What does natural supports education mean? In the follow-up email, I'm going to send a link. I have 2 things linked here, but I'm going to send links to pages that will explain each of these in more detail so you can get a better understanding of what each service is and what it means and what it does. And with that, I am going to go ahead and stop sharing. And I am going to turn it over to Jenna.
Thank you. And just give me a thumbs up if you can see my slides. Yes, great. So like Christy shared, I am here to talk all things about the wait list for the Innovations Waiver. There is a lot of information, and I do welcome any and all questions. Just be sure to put them in the Q&A. I already saw a really good question, and so while I won't talk about it in the content of my slides, I can answer that at the end. My role at the Autism Society, I do a lot of different things. This is information that I've learned along the way that I also have realized it's not really stored anywhere centrally. It can be hard to find. And so I just want to equip you all with as much knowledge and information about this process as I can, because I think it's very important and it's something that I'm pretty passionate about. So our time together today, we are definitely going to answer the questions that are on your screen. These are really important questions because it helps us understand why we're even talking about this today, why it's important. We're also going to talk about, once you're on the wait list, how it's managed by, and at current time, it's managed by the local management entities or the managed care organizations across the state. And so the abbreviation for that kind of group of agencies is LMEMCO. So you're going to see that periodically through my presentation. But we're talking about places like VIA, Alliance Health, Partners, Sandhills, East Point, Trillium. Those are the LMEMCOs. So we're going to talk specifically as we can, rather, about what each of those require for you to get on the wait list. We'll talk about what a psychological evaluation is. We're going to talk about what the qualifying diagnoses are. We'll talk about why the diagnosis needs to be present before a certain age. And a couple other things. There's a lot of nuances to this topic. So I want to make sure that we're talking about it really clearly so that whenever you leave today, if you have someone in your life who would benefit from the Innovations Waiver, you're going to have an idea of what to do and what to expect. So the Innovations Waiver, Christy gave a really brief overview. It's a really big program and it has a lot of different terms and definitions and nuances of its own. And so today I'm not going to be able to focus on that program. That could be a separate presentation in and of itself, but I do want to talk solely about the wait list. So I first wanted to start by sharing these terms that you see on the screen. There are a lot of different ways that we refer to the wait list for the Innovations Waiver. So some people might call it the Innovations Wait List. And today you see on your screen the Registry of Unmet Needs. That's the more technical term that it's referred to in a lot of the documentation you might read and from the state level. Some people might say they are on the run, which means they're on that wait list. Some places have called it IDD eligibility, and still some people may just call it the waiver wait list. I want to be really clear that all of these terms are referring to the exact same thing, which is, I think, an area where this can get confusing. But if you can, we're going to give you a copy of the slides, but just having this to refer back to, because if someone's referring to it in a way that you've not heard before, you may not know that we're all talking about the same thing. So the run is important for a lot of reasons, but the biggest ones in my experience are that the Registry of Unmet Needs, this process, it's how you get in line. It's how you start waiting to get a North Carolina Innovations Waiver slot. If someone isn't on the wait list, then they don't have much of a chance of accessing the Innovations Waiver. The Innovations Waiver, it is the most robust set of services in our state for people who have intellectual and developmental disabilities. So in my opinion, it is a big deal. And I would love to see every person who's potentially eligible be on that wait list. Being on that wait list also makes sure that the LME MCOs are aware of who you are or who your family is and what you need, what types of supports you've needed across your life so far. All of that information is data for the LME MCOs and for state leadership to use when they're trying to figure out how much need and capacity there is in our communities, and how should they use funding, and what types of new programs or changes need to happen. It can be a big kind of jumping off point for a lot of advocacy to happen. Because our next slide is going to share just a couple numbers with everyone. So we know, and I think this was a couple years ago, there were about 12,500 people across our entire state that were actively receiving the Innovations Waiver. There were 15,000 people on the wait list just waiting for their turn to get an Innovations Waiver slot. And beyond that, at that time, we knew that there were more than 12,000 people that were eligible, but who were not on the wait list. So it's really clearly a kind of a supply and demand issue. There are so many people who would benefit from it, but we only have a certain number of spots. I also like to share part of my role is in a new service called Tailored Care Management. The Autism Society, we have about 140 clients in that program. Only 10 of the 140 had ever applied. I'm sorry, only 30. I'm sorry, only 30 had ever applied and were actually on the wait list. And 10 had applied and were denied, which meant that a majority of those folks, over 100 people, had never applied. Most of them had no idea what it was. They didn't know why it was important, and they didn't know the benefit it could have for their family's life or their loved one's life. So the run is managed by the LME MCOs. And though the LME MCOs, the way I like to talk about them, I think the easiest way to think about them is that they are like an insurance company for Medicaid. So, similar to an insurance company, they have a set of services that they say people can access, that they're eligible for. And they have money that then they pay for those services. And they also work with providers. So they have a network of providers who actually do the work in the community. The LME MCOs are in charge of managing funding for behavioral health services, but especially for people with intellectual and developmental disabilities. So even if a family has private insurance, and I think this is a really important point, even if a family has private insurance, if someone in their family has an intellectual and developmental disabilities or disability, the LME MCO is an agency they should know about, because there are services like the Innovations Waiver that can be available to you despite how much money your family has, or despite you not having Medicaid at the current time. The LME MCO, they are responsible for managing the wait list for the Innovations Waiver for the counties that they oversee. So the map on your screen, it has North Carolina divided into the sections that correlate with the LME MCO. So for example, I live in one of the pink counties, and so that's Alliance Health. So Alliance Health keeps the wait list for all of the counties that are in pink. So I think most people here, it sounds like, are family members, but especially if you're a community provider, I'd recommend making sure that anyone that you're talking with or working with has the current contact information for their LME MCO that manages their county, because that's a very important piece of this process. So the way that the waitlist is managed, I think it's pretty interesting and important to know that piece of information, because it helps you know what to expect. The Innovations Waiver is a slot-based system. So if you think of slots like chairs at a table, the goal in this waiver program is to fill all of the chairs at the table. They want every chair to be full, and then they start a wait list for people who don't have a chair. If someone leaves their chair and they remain out of their chair for a specific amount of time, then the LME MCO will refill that chair or that slot with someone new from the wait list. The reasons why someone might leave their slot on the waiver, they may choose to give up the program. Perhaps they have built the skills and they've gotten to a point where they don't need those supports quite like they used to. If someone passes away, they lose their slot. If they go into an institution or an intermediate care facility for a longer period of time, so some institutions include a hospital, a jail, or another facility, they may lose their slot depending on what time of year and how long. And so those are some of the nuances, but there are strict rules around parts of that. Or if they move out of the state, they lose their slot. Each LME MCO also prioritizes the Registry of Unmet Needs, or that wait list, by time waiting, which means that the people who have waited the longest are at the top of the list, and the people who have just been added and have just started waiting are at the bottom. And this is regardless of the level of need. On your screen at the bottom, I made a kind of an example spreadsheet, and this is just a visual example of what a wait list could look like. And so you see the people who were added to the wait list on May 1st at 3:12 p.m. are at the top, and the people who were added May 5th are at the bottom. It gets very specific. Oftentimes, more than one person is added to the wait list in a specific day. And so they actually go by the time that someone called or emailed or submitted the paperwork that they needed to submit. So your place on the wait list could really be a matter of minutes, depending on how many other people had called and sought to be placed on the wait list that day. The wait lists are also kept at the county level. So the wait lists and the time waiting are different for each county. LMEMCOs are in charge of determining how to assign new slots or empty slots across their counties. So if a person moves from one county to a new county, they should always let the LMEMCO know so that they can adjust the wait list accordingly. And so a question that comes up a lot around this is, are some county wait lists longer than others? And the answer is an overwhelming yes. At the end of the presentation, I have a screenshot of the Innovations Waiver dashboard, and it is a resource that I believe the Department of Health and Human Services put together, but it shows how many people are waiting in each county across the state. So that'll be a nice visual to kind of further explain this piece. So there are a few misunderstandings or myths about the waitlist that I want to clear up before I jump into the how to get on the waitlist, what to expect, what documents you need. So first, and I think perhaps one of the biggest myths, so I really want you all to take this away and to make sure that you're sharing this with other people if this ever comes up. A person does not need to currently have Medicaid or be Medicaid eligible to apply to be on the wait list. So someone whose family is quite wealthy can be placed on the wait list. Someone who has never heard of Medicaid could also be placed on the wait list. You having Medicaid has no bearing on whether or not you can be on a wait list for a program, for this program, the Innovations Waiver. Second one, clients or individuals don't have to be deemed disabled by Social Security in order to apply. We will talk specifically about that, but what is needed is proof or documentation of a qualifying disability or a diagnosis. And so I actually list out a couple of them for you. There's a lot of potentially qualifying diagnoses that are all under the intellectual developmental disability umbrella. It is a totally separate thing from being deemed disabled and getting disability income from Social Security. So again, you don't need to have Social Security disability. This one comes up quite often, especially if someone gets a waiver slot at a younger age and then, of course, continues to grow and develop and perhaps even go to college and live independently. I have personally worked with people who can and do live independently and still qualify for the Innovations Waiver and for the waitlist. So I would not count them out if someone has a qualifying diagnosis. I think it's always worth exploring to see if they can get on the wait list. A child can be placed on the Registry of Unmet Needs, or the RUN, as soon as the qualifying diagnosis is obtained. There are no age limits. So I like to give the example here that I was working with a family who were given a diagnosis of Down syndrome while the mother was pregnant. And then whenever she gave birth and had documentation that, the child was born on this day and they confirmed the diagnosis, they were able to give that to us and we were able to review it. And then, of course, place that little one on the Registry of Unmet Needs. So I think that that's an important thing. You don't have to wait until someone is 3 years old or 7 years old or 9 years old. As soon as there is a qualifying diagnosis, I just encourage people to make sure that the LME MCO can review that paperwork and determine if they can put them on that wait list. On the other side of things, I've also worked with individuals in their 50s, 60s, early 70s who had just gotten an autism diagnosis. And they can certainly also be placed on the wait list. There's a lot of benefit from this program. And I don't want people thinking that they're excluded because of their age. So again, if you have any specific questions, concerns, any of this feels confusing, just use the Q&A and we will be sure to touch on it at the end. So the big question that I like to start with is, what does my LME MCO require to get on the Registry of Unmet Needs, or the RUN? What is the process? And it actually depends on which LME MCO you are managed by. The interesting thing is that there is variation among our LME MCOs across the state when it comes to this process, right? They're all keeping the wait list, they're all managing, assigning slots, but the actual process to get on the wait list is not standard. There are some standard pieces, there are some standard requirements, and so that's what I'm going to really jump into today. But I do just want you all to be prepared that sadly, there is no standard process across the state. I learned that because I called all of the LME MCOs and looked on their websites. They definitely provide information about the waitlist, but some want you to call them and have an interview. One of them, they actually have you sign a release so that they can talk about your clinical information in a team meeting. Some of them do longer assessments that take an hour to an hour and a half. Some LME MCOs have an actual application that you fill out and that you attach your documentation to. And I think sometimes the more frustrating difference is that some LME MCOs, they actually have some thresholds of scores that they want to see in your psychological evaluation to place you on that wait list. So we're going to talk about adaptive function measures, or an evaluation of adaptive function. It can be a part of psychological evaluations, and that's where I have seen a lot of the variability. Some people are screened out of the wait list because their adaptive skills are assessed as being quote unquote too high. And just to get in front of any questions about this, I will share that the state is and has been aware of this variation. But to my knowledge, there are not yet any solutions to the variation. We just know that it's existing and that the processes are a little different across the state. But like I said, there is some standard basic information and documentation. And so that's really what we're going to cover today, because no matter where you live and which LME MCO you're working with, you need to be equipped with some specific things. So I'm going to dive into each one of these just to be really clear about what it is, what it means. We're going to start with actually what a psychological evaluation is. And the psychological evaluation is actually going to have those three things within it. So a psychological evaluation is very frequently diagnosed or very frequently diagnoses intellectual and developmental disabilities. The term psychological evaluation, it actually refers to a process as well as kind of the outcome, the document that you're going to need for the innovations waitlist process. The evaluation process will gather developmental, medical, behavioral, and psychiatric history. And usually psychologists that often have some support people with them, they provide tests or questionnaires or assessment tools to an individual and to their support people, like their family or other people that know them well. They're going to document their observations, and there's some amount of time where they're interacting with the individual to kind of document how that goes too. All of this is kind of put together for that product of the document that is going to it's going to detail someone's behavior and needs, and it's also going to result in a diagnosis. And I'll talk in a moment about why the diagnosis needs to be clearly written. And what I also love about psychological evaluations is that they provide recommendations for what you can do next or what you should look into. And I think more and more our psychological evaluations are recommending exploring the innovations waiver, which is great. So what is a qualifying diagnosis? There are a lot of them whenever it comes to the innovations waiver and being reviewed for that wait list. A qualifying IDD diagnosis might be any of those that you see on the screen, or any number of other diagnoses that fall under this umbrella. Some conditions can be quite rare, that don't really have a name. They kind of go by a deletion of some chromosomes. And then some of them are quite, we know a lot about them, and we know a lot of people that experience them. But this is just an example of some of the diagnoses that I've definitely encountered in doing this work, that can be eligible as long as they're documented. And then we also have adaptive function assessment. And so I'll talk about that as well. One of the hallmark pieces of the innovations waiver is that the diagnosis needs to be present prior to age 22. And so I think, why does it need to be present prior to 22 is a great question. This part can get sticky, but it really is because the waiver by design is targeting developmental disorders that begin during the developmental years, which is age 22 and below. Oops, I'm sorry. Okay. So one of the ways that this can get sticky is that some individuals may not have had the support that they needed while they were during these developmental years, or maybe they did, but they don't have the documentation from it anymore that confirms that diagnosis. I've certainly worked with a lot of people who had documents, but they were lost or destroyed, or they were in a school system and it's been 15 years ago. And so they don't think that the school system has held on to them. All of this is okay. And I actually think it's becoming more common. More and more psychologists are definitely becoming skilled at gathering information to confirm or deny the presence of an intellectual or developmental disability prior to age 22. And that can be done through interviews with other family members, through the client report of just detailing what they remember and how they recall being social, or how their communication was, or what was easy for them or difficult, and reviewing what records are available. So if any of you know someone that falls into this category, I definitely recommend that you have the psychologist clearly note in the evaluation their clinical opinion that this diagnosis, if it's autism, that it began prior to age 22. And I've seen most of the time that's good enough. It's hard to, you can't travel back in time. So I think people are doing the best that they can, but in general, there has to be something that documents that it did occur prior to the age 22, or that it's, our best guess that it is rooted in the developmental years. And this last question, what does it mean to be clearly listed? And so I gave you some examples on the screen. The diagnosis really needs to be clear and it needs to be confirmed. So at the top of your screen, this is an example of a diagnosis that is clearly listed and confirmed. It shares the exact diagnoses that resulted from that evaluation. Super simple, plain language. At the bottom of your screen is an example of language that I actually pulled from a psychoeducational evaluation. So that's an evaluation that someone received through the public school system. So this evaluation typically does not work to get on the innovations waitlist. And the reason why is that it just doesn't clearly state and proclaim the diagnosis. The highlighted language, it does talk about autism, but again, it doesn't clearly state this person has autism, in my opinion. So because of that, it's generally not accepted for the innovations waitlist. And while I see the logic here, I think it puts families in a tough spot. Your child or someone could have just gotten a diagnosis, or could have just had a psychological evaluation done. It could have all of the right assessment measures or evaluation measures, but simply because it doesn't clearly proclaim this person does have autism or does have this qualifying disability, it's generally not accepted. So we talked about the psychological evaluation, and we talked about kind of the multi-part of a qualifying IDD diagnosis, clearly listed, begins before age 22. So now we want to look at number 2. We want to talk about what are those psychological and medical assessment measures that can confirm IDD diagnoses. So generally, the type of evaluation needed to confirm a diagnosis should match the general type of developmental disability it is. I think this piece is also confusing, and it can create some frustration for families, because if you were told to get a psych eval, you got a psych eval, and then perhaps they're saying, well, you didn't get the right kind. So generally, if there is a medical or genetic cause to the intellectual or developmental disability, the LME MCOs will want medical or genetic documents to confirm that. If the disability is related to delays or disabilities in fine or gross motor function, the LME MCO will want documents from specialists like physical therapists or an evaluation that assesses the fine and gross motor abilities. The aim here is to make sure that the person providing the diagnosis is actually a specialist for that type of disorder and that they have the authority to diagnose it. So the things on your screen, these are really just examples to use if your family or someone you know are at the beginning of this process, or they've been told that they don't have the correct kind of evaluation. But again, if there are questions about this or specific questions about this, put it in the Q&A so that way we can help kind of demystify and make this a little bit easier to understand. I do think this part can be particularly confusing. And the third piece, that basic information that's needed to be placed on the innovations waitlist, is an adaptive function assessment. So an adaptive function assessment is really just a different assessment measure, and it'll show up as really just another a heading with some writing and some scores. I think the scores are sometimes required in the psychological evaluation in the document. So I provided on your screen 4 examples of the actual assessment tools or the questionnaires that can help determine someone's adaptive abilities. So those are the Vineland, the ABAS, the DABS, and the SIBR. It isn't really important that you all know these very well or even remember them, but I think it is really important if you're seeking a psychological evaluation specifically to make sure you can access the Innovations Waiver waitlist, that one of these is on your psychologist's radar and it is something that they're going to do. I'll also say, and I actually think I talk about it here, yes. So the adaptive function assessment, it's oftentimes a questionnaire or checklist that the psychologist will give to the parent or someone who knows them really well. And you'll actually be able to attest as an adult in their life what they can do well, what they need support doing. I think it's really important if you find yourself in that position to really think about, if I take all of the support away, what can this individual do solely independently? What did they know? What routines can they initiate? What can they follow through on? Because we often, being strengths-based professionals and people, we often do answer, I think, a little more favorably whenever we encounter questions about what the people we love are capable of doing. What that can do, though, is it gives an inflated score or picture of what the person's true baseline needs are. And I think this can come up to, like, this idea, especially with parents as they age and they have a family member that has special needs. Um, this idea of them not having someone they know well and someone who knows them that can support them through all of their kind of daily function is really scary, because I think we do a lot for the people that we care for. We probably do more than we realize. So all of that to say, um, I think this piece is really important. And I do think, again, if you find yourself in this position, do really consider, what are they capable of if I take away the visual supports I created, if I take away the timers and the reminders and even the alarms on phones to remind them to do things. If I'm not sitting there with them and helping interpret a job application, is that something that they're able to navigate and maneuver on their own? But to kind of back up, adaptive function in and of itself, it just this assessment is measuring how easy or difficult it is for someone to do a variety of activities. So the logic is that the psychological evaluation, it's going to land on a diagnosis. The adaptive function assessment, it's going to tell us how that diagnosis impacts that person across a variety of life areas. So how does it impact them at home? How does it impact them socially? How does it impact their communication? How does it impact them at their workplace? So some examples of questions that an adaptive function assessment might ask are, can the individual say the month and the day of their birthday when they're asked? Can they help prepare foods that require mixing and cooking? Can they travel independently to an unfamiliar place? And can they fill out a job application? And again, I think sometimes the answer is it depends. And I would encourage you all to really think about, without the support that you've worked so hard to put into place, what would they be able to do? And the last thing I'll say about adaptive function is this is another area where the LME MCOs have some variance. I've spoken with some LME MCOs that they want to see a score at or below 70 for the kind of composite or average score for adaptive function. And I've asked that same question in the same way to other LME MCOs, and they have said, no, you don't need a specific score to go on the wait list. So again, the state is aware of this variety, but just so that you know, there, depending on where you live, there is a chance that they'll want the actual scores and that they'll be looking at those closely. So the other big question that we get a whole lot, and I think I forgot to mention this earlier, but I did give the numbers of the number of people waiting for innovations. The last snapshot of time waiting that I have is that on average, people on the Innovations Waiver waitlist wait for a slot for an average of 9.5 to 10 years. That is a very long time. And so this slide I think is particularly important. I'm on the wait list probably for 10 years, maybe more. What should I do now? I got on the wait list because I would benefit from these services. I have needs. I need to learn things. My family needs a break from my care. Maybe where I live is not the best fit for me. What can I do? I chose a stormy cloud because I don't love the answers that we have right now. Um, there are some IDD services that are available. So some services you could access while you wait, depending on the type of insurance you have. But I think that what's out there is, it's fine, but it could be a lot better. So what I'll share with you, the state is transitioning away from the services that are on your screen. So historically, there were Medicaid and state or other funded services that also varied depending on which LME MCO was managing your county. That once they said, okay, you're on the wait list for innovations, here are some things that are available that you might benefit from. Historically, I would say for a lot of people, these services have been great, but too little. People need a lot more support than what they've been able to access. And for anyone who's here or who works with families who don't have Medicaid, who perhaps have private insurance, these services are usually not available. The state or other funded services often came with the requirement that that families fill out an application stating how much income your family receives each year. And to qualify for those, you do have to be quite low income. So again, I think that we still don't have a great system for supporting everyone, but this is historically what has been available. And we're actually in the process of transitioning to these new services that are called 1915I. In July, the federal government approved the 1915I waiver for the state of North Carolina, which is exciting in that it's opening up more Medicaid services for a bigger population. So the services on your screen are going to be available for people that have things like intellectual and developmental disabilities, as well as people who have things like a traumatic brain injury after the age of 22, people who have serious emotional disturbance. And so that's exciting. And I think the intensity of the service, like the number of hours you can get, I think for community living and support, which is like a skill building personal care service, I do think the number of hours that people will receive will be higher. So again, for the Medicaid covered population, I think that that's exciting news. Um, I will just really be honest that I have never found like a great answer for what privately insured families should do while they're waiting, especially if their loved one has higher needs, if their behavioral needs are getting so high that they're having trouble supporting them at school or at home. I think it's a lot of being creative and piecing things together that are available. And so I will be sharing with you at the end of my presentation a variety of resources that you all can take a look at and certainly use, especially if you fall into that category. But for anyone who's waiting, regardless of your insurance type, there are a couple things that I really encourage you to do while you're waiting for the innovations waiver. I strongly encourage you to call at least once per year. A lot of families, they tend to do that around their child's birthday. That's a really good kind of touch point. And just to call and make sure that your loved one or whoever you're working with is still on that wait list. You also want to make sure that the waitlist date they have matches what you think it should be. And while mistakes are not super common, they definitely have occurred. There have been people who somehow their name has been removed from the wait list. But, I think a really good thing is that these families have kept paperwork that then they can show to the LME MCO to say, actually, you sent this to me and it says this is my waitlist date and it confirms I'm on there. So again, I think calling yearly just to make sure, and it's a good time to also update the LME MCO on what your needs are or what your loved one's needs are, especially if they're higher than they used to be. The LME MCO, they have no idea who who we are, what our needs are, if we have unmet needs, if things are getting harder for us. They have no idea unless we call them and unless we tell them. The thing I appreciate about the LME MCOs is that if you call them, every single phone call they receive is logged in a system. And so they have to take notes on it. And if you're giving them information about you or your family, just to say, things aren't going well, I need more support, where am I on the wait list? Is there anything else that can be done? Um, they may have funding or different programs that are available that you didn't know about, or they may be able to put you or your loved one on a list for something like an emergency innovations waiver slot. And so those emergency slots, they're reserved for people who can't wait until their name comes to the top of the list. Now, I'll say there are not many of these slots. Each LME MCO tends to get additional ones every year, but they don't get a lot of them. And there's typically, you know, dozens and dozens of individuals who are asking to be considered for them, and they perhaps have 5 or 7 to provide. Um, but I also encourage you to make sure you're calling and sharing with them what you need, because then you're creating some evidence. So in the future, if you need something, they could always look back and say, you know what? They have been calling and they have been trying, and I have it right here. And so, maybe we could consider them for this program or put them on the emergency slot list. So how long will I be on the wait list or the Registry of Unmet Needs? When will I get a slot? So that is sadly impossible to estimate. And it's based on all of the reasons and probably more, but definitely the reasons on your slide. So each county has its own wait list, and they're going to have a different amount of movement in slots. So if people are passing away or they're moving or they're going into institutions, or perhaps they're choosing to leave the program, that's going to be different county to county. Um, People may be moving into the county that you live in, and perhaps they went on the wait list before you. And so then that's going to make you move down on the list in your county. And so that's impossible to predict and estimate. Sometimes people who have been on the wait list, now remember, it's an average of 9.5 to 10 years. It might be hard for the LME-MCO to find them when their name comes to the top of the list. So what they end up doing, they might have to skip that person after they've attempted to contact them every way they know how and go to the next person on the list. So in that way, you could be kind of far down on the list, but if other people are not able to be reached, you might get a slot quicker than what you anticipated. The other really important thing to know about the Innovations Waiver is I've been talking today about getting on the wait list to wait for a spot. When you get a phone call from someone at the LMEMCO and they say, your name's at the top of the list, you have to go through another eligibility process to make sure that you're fully eligible for the Innovations Waiver. So you have to be eligible in one way here, and then you have to be reviewed again in another way here. So it has happened that people wait all that time. And then whenever their name gets to the top of the list and they are called about a slot, they are found not eligible. There's a lot of nuances there that, I think if this is impacting you or you're really curious about it, put it in the Q&A and we can definitely provide that information. But it's not the norm, but it definitely happens more than what I'd ever like to see. And then one of the last things the LME-MCOs, there is this effort, and I think, I wouldn't call it a mandate, but I think the state wants them to equitably allocate innovations waiver slots across the company or across the counties that they manage. And so I know Wake County, it's a big county. That's the county I live in. We've got lots of people. We've got a really long wait list, lots of waiver slots. But I do think that there has to be effort to make sure that kind of a similar percentage of people in smaller counties or rural counties are also receiving slots. So it's not always going to be exactly like, Wake has a really long wait list, but they may need to allocate slots to another county just to make the distribution more equitable. So the resources, and you will get a copy of the slides, and there should be a link at the bottom of each one just so that you can also access this information. You're not limited to what I was able to put on a slide, but this is just a screenshot of the Innovations Waiver waitlist dashboard. So this is interactive. You can actually click on the counties and get specific numbers, but you can see the bar graph up here shows all 6 of the LME MCOs and how many people they have in their counties that are waiting. And then this horizontal bar graph that's shades of blue, it shows you the wait list by county. And so each county across the state is represented here. And I think it is an interesting visual look at just the variation across the state. For anyone here who has Medicaid or is working with folks that have Medicaid, individuals with Medicaid who are included in the tailored plan are now eligible for and should be receiving tailored care management. And so that actually assigns a helpful person who can help manage their healthcare needs and their services. Um, that person is also required in order to access those new 1915I services. So this slide has the services listed with a brief explanation about what each one aims to do. And then the link at the bottom is going to take you to some more information from DHHS. Again, these are in the pipeline, not yet fully available to everyone. But I do think that, I'm excited because I think it's moving us in the right direction. And I wanted to make a plug for the Autism Society Autism Resource Specialists. These are some of my favorite people in the world. You don't have to have a certain kind of insurance. You don't have to prove to us that you have a diagnosis. You just have to have some needs and live in our state, and they can be a huge help whenever it comes to demystifying some of these complicated processes and even walking alongside some families where this is just a lot to take on. So the way to access them if you have autism, suspect a diagnosis of autism, is there's a web form that you can access on the link at the bottom of this slide. And lastly, I just wanted to make sure that you all have my information. And so I do welcome emails. I think emails are a better way to get me than phone calls because my phone calls just stack up throughout the day, and emails are a nice visual reminder for me. But I encourage you, if you have specific questions and we don't get to them through the Q&A, that we can certainly dialogue, and I'm happy to help because, again, I think if you're potentially eligible for this, I would love to see everyone putting their name in and getting on that wait list. And that's it. I'll leave this up for a little bit just so that if anyone wanted to jot down my information, but again, we should be giving you all a copy of the slides.
Yes. So we will. Thank you so much, Jenna. That was such great information. So real quick, now that Jenna's gotten through her content and we are going to go to questions, we're going to launch an evaluation poll real quick. There you go. It should pop up on your screen. It's really quick, multiple choice. We appreciate your feedback. Thank you so much. So we are going to go over to questions. I do see that somebody raised their hand. So we are not going to be unmuting participants. We have over 100 folks on tonight. So if you have a question, you can go ahead and put it in the Q&A. And we are going to go down all those questions and try to get those answered. And then whatever we don't get to, Jenna was nice enough to offer to take all the questions and formulate a Q&A document. And then we will send that out with the follow-up email. So we are going to go tackle questions. Are you ready, Jenna?
I am.
All right. First one is, and you may have answered this, is there a way to check the status or where you are on the wait list?
Yes. So that is not accessible anywhere online. You'll need to call your LMEMCO. Whenever you call, they're probably going to ask the person's name, their date of birth. If that person is their own guardian, you either need a release of information or they need to be given consent in some way for you to call on their behalf. But you'll get that via phone, and you can also ask that be emailed to you during that phone call so that you have it documented in your records.
Fantastic. Okay, next question. And this is a question that I see a whole lot, and it is on my to-do list to create a fact sheet on these differences, but it just feels so big. What is the difference between CAPC, Community Alternatives Program for Children waiver, and the Innovations waiver?
Yeah, so they're both Medicaid waiver programs for people that have things like intellectual and developmental disabilities. I think if you think a little bit more what it looks like, CAPC is often a program that serves more medically needy folks, also has a wait list, not near as long as Innovations from what I'm aware. But only for children, right? So you can be on both wait lists. You can be receiving CAPC and be on the Innovations Waiver wait list. The Innovations Waiver services at their core, I would say, are more robust and habilitative. So teaching, skill building, like teaching a skill that hasn't yet been developed. The other big difference with innovations is, and Christy, you jump in, but like the
Mhm.
residential supports that are available in innovations, there's not a comparable piece of that on
Mhm.
CAPC.
Yeah, so CAPC is really tailored more to those. It's for children who are considered medically fragile or complex, age birth to 20. And that's, I know that there's some funding limits that are more with the innovations waiver, but there's some different things that are offered through CAPC. So what I'm going to do in the follow-up email, I made a note. I'll send the page to the innovations waiver service page, but I'll also send, and it'll also include something called the clinical coverage policy, which is a really long document. But if you want to go down a rabbit hole, you can see all of the dollar amounts and everything that's in it. And I can also send the same for CAPC, and you can look at it all. I will plug a friend of mine, Jenny Hobbs, who knows a whole lot about CAPC, and she did do a webinar one time, and that she had some slides that compared the two. So I'm going to go back and look at that and maybe ask her if I can share that as well, because she just did a nice quick comparison of the two.
The
And I
next
believe,
one is a
mhm,
good kind of segue. So, yes, a young adult can transition from CAPC to innovations. You need to get in contact with the LMEMCO to make sure that they know that you have CAPC and you want to transition to innovations. It is not automatic. CAPC and like your CAPC case manager and the LMEMCO aren't necessarily talking, and they need to. The LMEMCO needs to know that you exist, that you want to transition. The other thing I'll say is that there's a small number of slots that people coming from CAPC can transition to the innovations waiver. So it's not a guarantee. Um, it's like a handful each year. So, if possible, plan ahead, make sure that they know and that they've got it documented that you're going to want to transition. And, I would say stay on it and make those phone calls and make sure that you're talking to them about it and that they're walking you through that process.
all right, next question is, in Wake County, the wait for the waiver is years long. Respite services are part of the waiver. However, staffing is abysmal. If staffing isn't available, what happens to the money used for staffing?
That is a great question. Um, so yeah, theoretically, like the way that the funding works is that the LMEMCOs get a per member per month rate. So if you live in Wake County and you have, a child or loved one that has Medicaid and that should be getting those services, the LMEMCO gets the money to pay for them. But then when the staffing isn't there, I can't really answer that. I don't know. I think that that's a great question, because, yeah, it should be going towards staffing. I know that staffing is abysmal nationwide. I mean, I'm not like super old, but I've never seen it quite this bad. And like since the pandemic, it's especially just, it's awful. I feel for any family that's impacted by it. And I don't know. I don't know that we have any answers for that.
Mhm. And maybe best, ask the MCO.
Yeah, and like the state as well, because this is the system that they built, and I think it's a super fair question because those
Mhm.
are Medicaid dollars that need to be going to people who need services.
Very true. All right, next one is, we moved our daughter from Wake to Chatham County, where the dashboard shows, almost 3,000 in Wake down to 78 in Chatham. Apparently moving her has impacted the wait list. How does this move impact her?
Yeah, so whenever and it really goes by the permanent address. So if your daughter moved from from Wake to Chatham, and if you moved her spot on the wait list from Wake to Chatham County, then she's going to wherever her date and her time puts her on that wait list, that's where she'll go on the wait list in Chatham. Again, Chatham is a smaller county, less populous than Wake County. And so that doesn't for sure mean that she'd get a slot quicker. But whenever they're giving out slots and they're trying to right size, if she's higher up on the wait list, there's a chance that she would get one quicker.
Mhm. Next question is, if you are receiving CAPC services, can you also be on the Innovations Waiver waitlist?
Yes, please get on the wait list.
Okay. For children who are not eligible for Medicaid because their parents' working income, will they be able to apply for the waiver?
Yes, so you do not need Medicaid to get on the wait list. This is a good question too to think about. Like, let's say your child's name is at the top of the wait list and your family income is too high for your family to get Medicaid. One of the requirements that the Innovations Waiver waives or kind of says we're not going to factor that in is your family income, right? So I've worked with families who are quite wealthy, but the individual getting the waiver slot, they don't have income of their own. So they get Medicaid because Innovations is only looking at their income. I think that gets confusing, but the long story short, yes, they can apply for the waiver. Please apply for the waiver.
And if your child or young adult or adult does have the Innovations Waiver, they themselves, because they can work, right? They can get income. Sometimes a relative passes away and leaves them money or gives them some things can happen. They have to stay under that Medicaid income eligibility for one person.
Yeah.
Okay, next question. Who decides how many slots are available?
So that is, I think, the General Assembly.
Yes.
They stick it in the bills that come out. So it gets pretty exciting and nerve-wracking at that time of year, but they decide how many additional slots they're going to allocate. So I don't know, a year or two ago, they had like 100 extra slots that they put in there, which would be one per county. I mean, whenever you break it down, it's like, I love that they're thinking about it, but it's a drop in the bucket. But it's our legislators that they decide how to allocate it.
So the message there is email your legislators, your representatives,
Advocate.
and let them
Yes.
know.
Yeah. Yep.
Let's see. Okay. I will digress. When can you apply?
You can apply as soon as you get a qualifying diagnosis. So my example was the family who had a child born with Down syndrome. As soon as you get that diagnosis, you can send the documentation to your LME MCO.
Next one is we've been on the wait list since 2014, and we were called one time being told our time was up, and we were interviewed, tested, spent the entire day testing and answering questions. It was very detailed. They told me they'd call when we were ready to start, and we never heard anything else. That was March 2017. Do you think we got passed up?
Yeah, Melinda, I would be really curious about this. They should have some documentation, and it's your loved one's medical record at the LMEMCO, so you have a right to request it. And so I would encourage you to call the LMEMCO and let them know this exact information and have them look into it. If your name was at the top, there should have been some sort of documentation that either said you weren't eligible, but if you all have Medicaid, then you have appeal rights, right? So I think that there are a couple layers there that I'm happy to talk with you more about just to see what happened, because that's a long time to wait for something, and we want you to know for sure.
And if you have any documentation you got in the mail, snail mail, or any emails, dig that up and get it, because that's going to be your evidence. Because people make mistakes, balls get dropped, things happen, and it could have been an error. Okay, next one. Let's see. So an applicant who is not on Medicaid could be a special case for the MCO and could get on the wait list.
So if I had a qualifying diagnosis and I've got private insurance, I could apply and be on the wait list. You don't even have to be a special case. You just have to have a qualifying diagnosis. We have worked with families who have millions of dollars and their child can still be on the wait list. You don't have to have intense needs. You don't have to prove anything beyond that you have that qualifying diagnosis.
And this might be, well, so this person says been on the wait list for 2 years, going on 3. We're with Sandhills and they keep saying they don't have people. So what is there else to do?
I assume this is about just those services while you're waiting. Yeah. And so again, I think that this is where I'm not too shy to file a grievance with an MCO against an MCO, because at the end of the day, these are services that they're telling you you should be able to access that you can't truly access.
Mhm.
I don't feel like you just have to deal with it. I feel like you can give that feedback. And I think that the state needs to hear this because there are certain parts of our system that are a little broken. They're not functioning the way they need to. And I think that we do need kind of that collective, people sharing that feedback and letting them know that this isn't working for us.
Next one is if my child gets on the wait list in North Carolina, but we later move to another state, would she have to start all over in the other state on their wait list? Yes.
Yes. Yeah. And I know not all states are created equal. I think our wait list is one of the worst. I've seen like the list of states across the nation, and we're always toward the bottom. But some states, there isn't a wait list or it's shorter. But yes, this is just for North Carolina. It's not
Mhm.
portable to other states.
So I do want to add, so that's why, I mentioned in the beginning, that the waivers, or did I mention this in the beginning? I don't know what I do. Waivers don't transfer from state to state because states get to decide how their waiver programs are going to look and how they're funded. So they actually apply to the feds and say, we want this waiver. Here's what it's going to look like. They can even say it's not going to be statewide. We do have a waiver that's not statewide in North Carolina. It's the TBI waiver. Um, and some states don't have a waiver for the IDD population. Some states don't have any waivers and they can do that. So because the waiver systems can look so different from state to state, even though Medicaid is a federal program, eligibility states get to decide what they do with their Medicaid dollars independently, basically. And then that kind of goes into the next question: who funds
Yeah.
the waiver, federal or state? So states get to decide what they do with their money.
With the
So
federal money. Yeah.
mhm. If the state knows there are potentially 27,000 people in addition to the 12,000 people that are receiving Innovations Waiver services, why doesn't the state of NC increase money for the Innovations Waiver services?
Great question. I think that's a great question for your legislator.
Legislators, yes, because they are, yeah, who decides that?
Yeah,
They decide where the money goes. It's not the
that's right.
state, it's not DHHS. DHHS has nothing to do with it.
Right.
And it's the North Carolina General Assembly that makes all of those decisions. And then there's a lot of folks and organizations, and state folks cannot advocate, right? We can't lobby,
Right.
advocate. And then there's organizations like ours that would love to too, but if we receive federal funding, we can't either. We can
Right.
educate, but can't lobby. So we really encourage families to email. And a little plug for NC Child. On NC Child's website, and I'm going to send this in the follow-up email, they have some recorded webinars, Advocacy 101, and how to talk to your legislators or how to email your legislators. I'm going to send those webinar recordings also to everybody. So if you want to email your legislator, but you're like, oh, I don't know what to do or how, that's a great tool to use. Let's see. Next one is, how can a state program have different qualifications? Yeah.
Yeah.
And I
That
don't know if you're
is
talking about internally, like with our state, like
the
with the
LMEMCs.
MCOs, or
Yeah.
just how different states can have different qualifications for their
I can,
IDD waiver.
yeah, and I can speak to the LMEMCO differences is that DHHS, they essentially have a contract with each LMEMCO, and the contract language, like I did a deep dive because I was really curious about this too. The contractually, they're just obligated to have a process where they are screening people and adding them to a wait list, and a process that they're, filling the slots. As for what the process specifically looks like, that is up to each LMEMCO to determine that. And so I think that there's an opportunity there to make it standardized, but that simply wasn't how the contracts were written. And so each LMEMCO with their bevy of like professional people just kind of came up with what they felt like was appropriate and worked for them. And it has changed over the years, but that's where we are right now.
I was watching when the questions were coming in, and that's exactly, you were talking about all the LME MCOs and the different qualifications. So that was exactly
Yes.
what that was about.
Yeah.
Yeah.
Perfect. Okay, thanks, Terry. This is a good question. Can one choose which county you enroll in?
The answer is no. It's going to be based on the county that your permanent address is in. And so we've worked with people, there was a lot of confusion because they live like right on a county line.
Mhm.
And it's like, which do I go to? But it comes down to like looking at the actual real estate data of like, where do you live and which county is that address in?
Mhm. If there's a child who is on the waiver wait list and requires ICF placement, so intermediate care facility placement, how do you access funding for this placement? We do not have Medicaid nor any other funding except private insurance. We are mentally and physically exhausted, and I've asked for emergency slot, but we were denied. We need help. Oh.
So, there is a type of Medicaid that you can access. It's called 5045.
Mhm.
And if you actually Google like Medicaid 5045 or DMA, I think it is 5045, you'll see there's a PDF document that the doctor, psychiatrist, psychologist who is working with you would just need to attest that your family member requires out of home treatment for a certain amount of time. And so, this is how some privately insured families can access things like ICF placements or psychiatric residential treatment facilities, things that are exorbitantly expensive. But to get the course of treatment, families can't afford this. And so, there's a special kind of Medicaid.
And it's for children 20, well, children 21 and
Yes,
under.
that's right. That's right.
Teresa, email me because I've like been going down a rabbit hole with 5045 Medicaid. There's not a whole lot of information out there, but I do have the document that Jenna's talking about, and actually I can include it in the follow-up information if anybody else wants to know.
Yeah.
Some
The
people call it
document.
Medicaid for one.
Oh, okay. Yeah. The document, once it's complete, it does need to go to someone at DSS. And so that's going to be different from county to county. I used to know the Wake County person, but this is where having people that can help you dig and make phone calls is going to be really helpful because you want to make sure it goes to the right person for processing.
Mhm. Does the Autism Society of North Carolina have a list by county of pediatric psychiatrists that have awareness of psych diagnoses and emails needed by the waiver preferences? Ooh, that's a good question.
We don't. I think that we've got some good opportunities to kind of fill out our own resources. So, IDD informed physicians is a big kind of hole that I would love to see filled. And I think this is one too, is just psychologists that really know what's needed. What I encourage you all to do is to give that information to them whenever you make an appointment. So when
Yep.
I make an appointment for clients, I say it's got to have clearly listed diagnosis. Like, I love your paragraph narrative, but just like bullet point and put like these are
Mhm.
the diagnoses, and it's got to have adaptive function measure. He can, like, psychologists can use their clinical discretion and do any other assessment measures, but it's got to have those two things.
Yeah, and like Jenna said, that's what I was thinking in my head. Like, ask them, be like,
Yeah.
do you have, how many evaluations for the innovations waiver have you done? Are you familiar with what the innovations waiver is? Do you know what they're
Right.
looking for? Do you ask? You're
Hmm.
interviewing them, they're working for you, so you want to pick the right one.
I will say, even though we don't have necessarily a list we can give you all, if you contact one of our autism resource specialists, we've done this enough in whatever county that you're in that we would have some folks that we could recommend. I'll also say waitlist for psychological evaluations are sometimes like
Mhm.
2 years long. So be prepared. And I would say, we want to call around and find someone if you need it more quickly that could do it more quickly.
We are going to, okay, try to get a couple more questions in. What about getting updated testing for your now adult child when they come up for a slot? Because by the time they come up for a slot, the testing that was submitted when we applied is too old, more than 3 years. Who's qualified to conduct and score in ADOS or CARS? And how do we, well, I'll let Jenny answer it. Do we, sorry,
So
this intro. And do we as
yeah.
parents know who's qualified?
Yeah. So I think that what this is my answer. And this is where, if I were helping you, this is where I would push against the LME-MCO. So I know the best practice for children is a new evaluation every 3 years, and for adults, it's every 5 years. My argument would be it is really not within the DSM that you get an autism diagnosis and then you stop having it, right? So if they confirm that autism was present via an ADOS or a CARS historically, what I think would need to be updated is just a clinician to review that and confirm based on their clinical opinion that it's still present, but to update the adaptives.
That.
I do not
Mhm.
think that the ADOS and CARS needs to be updated.
Mhm.
Um, but I know the LME MCOs sometimes they die on hills that I necessarily wouldn't. Typically, the ADOS and the CARS needs to be a specially trained psychologist. The Teach Autism program is definitely a big provider of those, and they're the ones that have a wait list. It's like 2 years long.
Will we be able to view this meeting later? Yes, you will. And I will send a link to this recording in the follow-up email. Let's see if we can squeeze in a couple more. If you qualify for the wait list, why are you then having to qualify again when you get a slot?
Yes. So I think the honest answer is because it's been 10 years since you went on the wait list, right? So you think if someone is 12 years old when they go on the wait list, another 22, there's a lot of development and learning and change that can happen in there. Some people have actually advocated for no qualification, just to put me on the wait list whenever I ask to be, and then I have to qualify when my name comes up. And I think that makes a lot of sense. But I don't get to make the rules at the LME-MCOs. So I don't know.
I wish
I
you
think
did.
it's because of that. Yeah, I think it's because of that amount of time, which that makes sense. But then why make people jump through hoops at the beginning? I don't know.
If an individual that we want to get on the wait list is her own legal guardian, who is able to initiate the process?
So technically, if they're their own guardian, they should initiate. However, they can give you permission to do that with a release of information. Some LME MCOs, they just would put her on the phone for a brief moment to say, yeah, I give mom permission. But I would ask the LME MCO what they're going to require. But with written permission, you should be able to do it on her behalf.
If you move into a living center, do you then
Like an
lose an
ICF.
innovations waiver slot? Okay.
Yeah.
Does one beget the other? Well,
Yeah. So yeah, if you're talking about like a living center, like an ICF group home, those are mutually exclusive. So if you had the waiver but moved into an ICF, you would lose your waiver slot. So you're making a decision at that point. But you can be on the wait list for the waiver and go into an ICF. So
all right. When the state does the county allocation, is it done by county population, by county Medicaid population, by county Medicaid eligibility percentage, or some other metric? That's a good question.
it's a very good question. So I don't know specifically what numbers. It's not solely population. It might be, yeah. I don't think I could intelligibly even guess what it is. I don't think it's solely population. I think the population, like the county size, does matter. But I do think that they drill down a little bit more specifically with Medicaid or IDD. But I think that that's a question to ask, the LME-MCO, see if the state is aware. I think those are all really interesting questions.
And also, I do want to say, because it popped into my head, I got to say it before it leaves. MCOs have family partners, and I believe all of them do have a family partner program. And that is going to be a person with lived experience being a parent of a child with IDD or significant mental health issues or substance abuse. And you can usually find, sometimes it's well hidden on the MCO websites, but you can find family partner contact information, and they're employees of the MCO, and you can ask all of these questions. They would be happy to help you because they are also parents, just like us, who work in this field, and they want to help you navigate all of this and understand it. So they would be happy to help. Let me see if we have time for, try to squeeze in another one. If co-occurring bipolar and autism, is there potential one-on-one or respite care provider through ASNC?
Yeah. So if you, let's see, if you have Medicaid, there is a service called respite that could certainly support someone that has co-occurring bipolar disorder and autism. You're going to bump into the staffing issue that everyone else is. I think the question for the MCO is my loved one or family member, are they eligible for respite? If you don't know the answer to that, they should clearly be able to tell you that, and then you would then be contacting providers. But again, it's the staffing issue that's probably going to be the biggest barrier.
Is there a number to call for each county to get on the wait list? And yes, that's going to, what I'm going to do is, I know it's in your presentation, Jenna, but I'll send a link to that MCO Managed Care Organization directory.
Mhm.
And if you scroll down, it's going to have all of the MCOs listed and what counties are in their catchment areas and the contact information.
Yeah, and that goes to Bridget's question. So
Mhm.
the form that might be required, it could be buried in the website. And so don't worry about that. What I would say is to start the process, just call.
Mhm.
That's going to be the easiest way. And if they have a specific form, they're going to direct you to it or send it to you.
And I think that like Trillium and Sandhills, you can get the form on there, but I think because Via is my MCO, I don't think they have a form on their website, or if they do,
Yeah.
it's buried. They want you to call.
Yeah.
Is respite care available now while waiting if you do not qualify for Medicare? And I'm assuming she meant Medicaid.
So without Medicaid, unfortunately, there is no respite that would be available in this like publicly funded system. But this is where I say people without Medicaid, we've just got to be creative. And I think that, you can certainly talk with other families, but there are some places that have like respite grant programs. I don't know. It's tricky. It's tricky when you don't have Medicaid.
It is, unfortunately. Um, So we are out of time. I think we could be on for like another hour and talk about this, but Jenna was so nice to offer to, she's like, I'll just take all the questions and I'll answer them all in a document. We can send it out with the follow-up information. So my goal is to have that follow-up email out Monday, but if we need a little more time to get all the questions together or to get everything together, I want to make sure the information that's in the email is everything it needs to be. So it might be Tuesday. If you don't have it by the end of the day, Tuesday, you can poke me. But otherwise, that is going to be it for tonight. I want to say a special thank you to Jenna. It's a fabulous presentation. Thank you so much. I feel like I just find something else new every time I see you do it. I love it so much. Thank you so much to our interpreters. We really appreciate it with Full Silver Interpreting. Thank you, Terry, for providing some support. And thank you everyone for joining us tonight. We really appreciate it. And we are planning to do this webinar again on January 25th from 12 to 1. So during the day for those folks who would rather do it on their lunch break, or professionals who want to get it in during their workday, because the more people that know this information, the better, and we can help our kiddos. Thanks for joining us tonight, everyone. Have a great evening. Bye-bye.